Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the opportunity to sit down with Darrel, who is the Vice President for Marketing and Communications for HealthNet, the largest commercial insurer of Medi-Cal managed care here in California. Today, Darrel's going to talk about the redetermination process, which is basically the renewal of Medi-Cal eligibility year after year that was paused during the public health emergency. So now, Medi-Cal beneficiaries need to go through those steps, and about 75% of them need to take action. Today's episode shares how the state, as well as HealthNet specifically, is working with communities, whether rural or urban, and in different languages, to get the word out and remind folks to maintain their Medi-Cal eligibility. And if they don't, then it's anticipated that maybe 2 to 3 million of the 15 million will be without healthcare coverage. We hope you enjoyed today's episode, where Darrel also shares a little bit about his background and how he got into healthcare, including his time working for Governor Schwarzenegger nearly 20 years ago. We hope you enjoyed today's episode. Check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, checking out our videos on YouTube, or listening to us wherever you listen to your podcasts. Thanks, everybody. Enjoy today's episode. Darrel, thanks so much for joining the show today.
Thank you for having me. It's a pleasure to be here.
Yeah, and it's a pleasure to have you as well. So folks, I've known of Darrel's name, and I've interacted with Darrel over the years for similar reasons. But you were actually, Darrel, helping me coordinate shows for others at times. And now it's great to have you on. So we're going to get to know you a little bit today and really focus on the Medi-Cal redetermination and what that means for our state. But before we get into that, I'd like to get to know you and allow our guests to get to know you. So even though I've interacted with you mostly via email over the years, it's great to actually get to know you more on a personal level, like we do with most of our guests. So could you give us a little background about yourself, Darrel, but maybe something fun, like a surprising fun fact, something outside of maybe the HealthNet world or healthcare world?
Sure. So I sort of stumbled into working in healthcare. My career started in politics. So I worked for Arnold Schwarzenegger when he was governor back in the day. I don't know, now it's 20 years ago. And after him, I ended up working for the insurance commissioner because I thought he might be the next governor. He was ultimately unsuccessful, but I inadvertently developed a sort of minor expertise in insurance regulation. And it's a funny story to tell now because it's 15 years later. But so I went. I thought, well, his term is done. Steve Poizner. What should I do? Right? Let me go make a list of the insurance companies with the worst PR and start calling from the top. So the very first call was Anthem Blue Cross. They had just gone through a rate increase that became the poster child for Obamacare's passage. Okay. And I called up their chief communications officer and I said, hey, like I'm no longer, in a place at the regulator, but if you're looking around, and you need to staff, let me know. So 6 months later, he gives me a call and he says, hey, we have an opening in California, come do this. So, I worked at Anthem for 5 years. I then went to go work at a healthcare marketing and communications firm. It was then known as W2O. Now it's known as Real Chemistry. And now I'm at HealthNet, where I lead the communications and marketing function. The sort of change there is when I first started the consulting, I didn't have kids. And by the end of it, when you have 2 young children and a wife that works full-time also and travels, it's hard to get a text that says, hey, come to your East Coast client's office tomorrow. Yep. Don't know when you'll be back. Good luck, right? And my wife got tired of getting those texts. So, it was time to find a job that is equally fulfilling, but perhaps is more suited to having a family.
That's great. Well, you mentioned having a family, being with HealthNet. You mind me asking, where in the state you are today?
Yeah, so I'm based in Sacramento. I moved here about 20 years ago, and since the playoffs are going on, the basketball playoffs are going on right now, I now know that I grew up in LA. I've lived in LA, I guess, less time than I've lived in Sacramento, but I still haven't kicked the LA sports team. So I'm very sorry, Kings, but still rooting for the Lakers there.
Nice. Well, hopefully by the time the audience hears our conversation, Darrel, the Lakers are still in contention. As we record this, folks, we typically record a week or two out, maybe sometime sooner before the episodes. And so we're actually recording on May 19th, where the Lakers, the fourth quarter was quite interesting yesterday. They just disappeared for a few minutes. But that'll be old news.
I'm going to speak it into existence. I'm going to be cheering for the Lakers in the NBA Finals.
All right. Well, we'll find out when this is released. Hopefully that's true. So, that's great. And so as you're growing up, you mentioned you grew up like in LA, Southern California. At what point as you were growing up, were you thinking, hey, like politics is something I'm interested in?
Sure. So my family they immigrated to America in the 1970s. My parents came here separately. And we're Chinese. You grow up with the family knowledge that sort of where you are could change at any point. So I'm sure that if historians went back and looked at this, I don't have all the details correct, but this is sort of the story told to me as I was growing up. On my father's side, they were some sort of important official, whether it was governor or mayor or something like that. It doesn't really matter, but they were in some sort of power. The communists came. There was, we'll just say, a lot of ugliness, and they came to America. So the idea that if you're not trying to shape what's happening in your society, you may become a victim to it. So it became important to understand the levers of power and make sure that representation was there. Because while I suspect, I hope that nobody in America faces that sort of situation, it happens, and if you're not at the table, then who knows what might happen. So it was important to me to understand how America works. I happen to believe that it is the greatest land of opportunity, not without its own challenges, but there's a reason why people clamor to come here. And it's our job to make sure that stays the place of opportunity across the world, so that we can attract and hopefully find ways to keep people who are the best and brightest, and to let people who want to achieve do so.
Wow, that's awesome. So your parents definitely were going through some stuff. So you mentioned your family history is Chinese. Do you speak any Chinese dialect, if you mind me asking?
Much to the dismay of my parents. I can order, my parents speak Cantonese. I can order at a restaurant, kind of. But, their English is their second language. It was their priority to make sure that their kids spoke English fluently. Whether that was successful or not, I'll let the listeners decide. But, I should be better at it. And it's something that I'm trying to rectify with my kids. So hopefully they'll learn Mandarin by the time as they grow up.
That's great. Well, good for you. I'm actually married to a Chinese American woman. She was born here. And so her language is, or her initial language was what's called Toisan, which is I guess a spin-off, or what you'd say similar to Cantonese, or have some similarities to Cantonese. But I'm like you, I have kids, and shame on me, we haven't gotten them to really pick up on the Chinese language yet. But they're young; they're still in elementary school. It's not too late. So we're going to encourage them as they go to junior high and high school. But yeah, cool. Thanks for sharing about your background there. So let's jump into kind of the core content of why we're here today. Tell us, first of all, about who HealthNet is, and maybe break down a little bit more about your role within HealthNet.
Sure. So HealthNet is the largest Medi-Cal commercial plan in the state. We have more than 2 million Medi-Cal members. 1 million of those are in LA County, and then 3 million members overall. So that includes cover California, it includes the commercial market, and it includes Medicare. My role is I lead the marketing and communications function at HealthNet. Yep. And under my purview is redetermination, to make sure that our members have the information and take the steps necessary to keep their Medi-Cal coverage as the end of the public health emergency occurs.
Great. Thanks for the kind of wrapping that up. Now, question for you. use the phrase commercial plan. I think a lot of our audience are healthcare providers or work in roles where they don't really, know the nuances of what a commercial plan is and how is that different than like Medi-Cal in other ways?
So there are three different models for Medi-Cal across the state. There is the county-operated health system, where a county chooses to provide healthcare. So a good example is Cal Optima in Orange County, Gold Coast Health Plan in Ventura. So the county has one plan and they run it. In many other counties, there's what's called the two-plan model. This gets very technical and healthcare nerdy, but there's generally a local initiative, and then there's a commercial plan. In LA County, the local initiative is LA Care, and then HealthNet is the commercial plan. In other counties, Anthem might be one. There are other plans across the state that offer that. And then finally, I guess to be a complete healthcare nerd, there's what's called the GMC model, this geographically managed care. That's Sacramento and San Diego, where a number of commercial plans compete with each other for membership, and there is not a local initiative. So so HealthNet is the largest commercial plan across the state of California.
That's great. Thank you for the explanation, Darrel. And we're not going to talk about it today, but folks, some of the plans are shifting in 2024. Feel free to check out, do a quick Google search, go on DHCS's website or the Department of Managed Care, and you can kind of learn more about how things are shifting for 2024 and beyond. So today we're going to talk about redetermination. And I've been growing up in healthcare I've been in the healthcare world for 20 years, Medi-Cal more recently. And redetermination has always been around, but now it's in the news more than ever before. Can you give some of the audience may not know why. Can you share briefly?
Sure. So before the pandemic, there was an annual requirement that people provided information that they were still eligible. So do you still live in the county? What is your family size? What is your income, etc.? And the idea is that, hopefully people got jobs and they're no longer eligible for Medi-Cal. Maybe they moved and we want to make sure that they're accounted for in the right county. So there are lots of good reasons to do it. And prior to March of 2020, it just happened on an annual basis. Wisely, during the pandemic, they suspended that because, I'm sure we all remember we were afraid to go to the mailbox, right? We were wiping down our Amazon packages. So the federal government said, you know what, let's pause this until the end of the emergency. So nobody has to prove that they're eligible. And part of this too, we want to make sure that, especially during the pandemic, as many people were covered as possible. We just, in terms of the government, the COVID emergency is now over. That doesn't mean that the pandemic is not here, that people aren't affected, but as a sort of governmental action, it's been ended. So we now have to go through and, the technical term is redetermine, but we try to use the word renew for members because it's more English and it's more understandable. But people will need to go and provide information to make sure that they're still eligible. Go ahead, yes.
And why was April 1st, what did April 1st, which is, just short while ago, why was that an important date?
Yep. So April 1st is sort of the beginning of a 14-month process. The way it works is it's too much of a task to ask everybody to send in their information all at one time. Yeah. In California, that would be 15 million people or so. The state and the federal government decided wisely to make this sort of on a 12-month basis, right? The month that you signed up, there are exceptions to this, but generally the month you signed up initially for Medi-Cal is a month that it'll be your turn to update your information. So that process started on April 1st. Because you have 60 days to do these things, it's a 14-month process, but in California, we should start seeing the effects of this in the next 6 weeks or so, where in early June and July, we'll have a good idea of how many people are filling out their paperwork and whether what we're doing is working or not. In general, I'm sorry, go ahead.
No, please.
In general, the state estimates that out of the 15 million people on Medi-Cal, 2 to 3 million people will lose coverage as part of this process. Now, there's always people that you think, well, hopefully they got a job, right? Or maybe they moved, so they had coverage. They estimate that somewhere about half of the people that will lose it, so between 1 and 1.5 million people, will be eligible for Medi-Cal, but won't take the necessary steps. And that's really the moral imperative here, to make sure that we help those people understand how to fill out the paperwork, how to engage in the process so they stay eligible.
Got it. That's really helpful. So I know, folks who often are on Medi-Cal, may not necessarily be reading the news all the time or checking their mail or maybe not even use email or electronic means of communication. So what are some of the steps that you guys at HealthNet are doing to get the word out? Because this podcast is really intended more for healthcare professionals. You might have some of your members listen, but probably not the folks who really need to take action. So tell us what you're doing in the community.
So I'll answer this question two ways. So first, I'll talk about the sort of mechanics of redetermination, how it works, right? Because with that understanding, you'll understand why all the touch points make sense. So we now, we've established everybody goes 1/12 at a time, based on when they started. The state sends us a file that says redeterminate. This is who's going to be eligible for redetermination in a given month. They will run it through their system, and there's something called it's an auto renewal system. That's the English term for it. But ex parte is the jargon term for it. And what that means is there are people who interact with the government who they already know are eligible. So if you're on CalFresh, that's the jargon term for food stamps, or other government programs, they may already know that you're income eligible. So about 25% of people have to do nothing, and they'll be automatically renewed. So it's the other 75% of people that we're trying to reach. So the state will send them a yellow envelope, and they will have several ways to provide that information. You can mail the yellow envelope back. You can call the county of residence to update it. You can go to the website Benefits Cal to provide that information, or you can walk into a county office and update it manually if that's their preference. So they'll be asked to do that at the end of the period. If they don't do it again, the state sends all the managed care plans another file that says, heads up people, they didn't do anything. Can you please help out? And then we spring back into action. So we sort of approach this in two ways. One is we want to make sure that people know to update their information so that when it's their turn, they get the yellow envelope in the right place, because maybe you've moved in the last 3 years and we want to know where to send this. And then when it's right before it's their turn, we'll send them a text, an email, and a letter that says, heads up, it's coming. And then on the back end, if they don't do anything, we will send them flyers, we'll send them text messages, we'll send them emails, we'll robodial them, we'll live call them, any sort of way that we can think of reaching these people, we will reach out during that month. And then at the end of that month, if they don't do anything, then they're terminated and they will have to sign up for coverage anew.
Okay, so that's like direct contact from HealthNet. What else, does the community advocate as well? How does the community also help you guys make that connection?
We know that that health insurance companies may not be the most popular messengers. And just like, when we were trying to get people to get vaccinated, there are trusted community messengers. And I spent 4 months on loan from HealthNet to the state to run vaccine communications. So we're drawing a lot of lessons on what we learned to help people get vaccinated. So what that means is we're working with trusted community partners to help spread this information. And advertising research shows that somebody needs to hear a message 7 times before they finally understand it. So if HealthNet gets them once or twice through email or phone call, or if they actually open their mail and read it, they need to hear it a couple more times. So we have embarked on a process where we're working with doctors' offices to provide signage in their office, to provide posters, to provide flyers, so they know that if you go to the doctor's office, you'll see it. We're working with community-based organizations, so food banks. Can we get an insert into the box of food that week? can we get signage up at the pickup station? Can they send emails or texts out to the people that they serve? We're working with schools. We're currently working with the LA County Office of Education, partnering with LA Care to provide a toolkit, right? Because we know this isn't a competitive issue. This is something that we want to do for the community. So, can we use the existing distribution methods from schools to do this? As a parent, I get emails every day, soccer camp, don't forget to, come to back to school night. So, can we leverage those channels to get this information out? We're working with faith-based organizations. So can we, communicate through church bulletins? Are there seminars that we can give through some of the mega churches, especially in some of the areas that traditionally serve African Americans and Latinos? And this is the sort of work that we're doing. We're working with libraries too, because if they have programming, a storytelling day, how can we attach this to that? So we know that this is important, and we want to make sure they hear it from as many trusted messengers as we can find. Sort of separate from all this, we have a grant program where we work with promotoras and others to say, you're doing enrollment assistance already. How can we support you so you can help spread this message? Because we know that their hands are full and their capacity is at max. So can we help build that capacity for people who are already talking about health to these communities so they can spread the message? So we're leveraging multiple channels to reach as many people as many times as we can.
That's great. You mentioned connecting with like promotoras and community health workers. So for the audience, just a friendly reminder, many of you may not know, but this is a growing workforce, and there's benefits now for health plans and providers to actually hire community health workers and promoters to really get the word out. There's requirements that these workers actually come from the same background. So we actually did a podcast a few months ago on this benefit, where we had the leader from DHES talk about it. So I appreciate you mentioning that term because it's still relatively new for a lot of us, and these benefits. So Darrel, you've done a really good job, in a kind of wrapping everything in a nutshell of how the word is getting out. Is there anything I missed? I want to invite you to share more information that you feel you may not have shared yet before we wrap up today's episode.
Yeah, so I think it's important for everybody in the healthcare ecosystem to know that this is part of their responsibility. It's not just the state. They have a $25 million ad campaign, but we know that's not going to be enough. Yeah. It's not just health insurers after this. It's not just doctors. Everybody needs to reach out to those that they serve to make sure they know this is coming. Because if they don't, it means that we'll have to find these people again to sign them up again. And potentially they'll have a gap in care. They'll miss, necessary treatments. And, that's really the worst outcome that could come out of this.
Yeah, really good point. My day job, we serve Medi-Cal beneficiaries. And I realized that we have the ability, right, or maybe responsibility based on what you just said, to make sure our members, as we call them, Medi-Cal members, are aware of this and make sure you keep your coverage and you're looking out for this. So is there a play? I know maybe for HealthNet, maybe you can share with us if we have HealthNet members and we want to get the messaging and help you guys spread the message. Is there a place we can get tools or resources today that you can direct us to online maybe?
Yeah, so I would say there are two things. So if you work with HealthNet, we have toolkits available that help spread the word that people need to update their information to look out for the yellow envelopes. You can go to bridgingthedivide.com, bridgingthedivideca.com, and the resources will be there. In addition to that, DHCS has toolkits. I will, as a point of pride, I will say I appreciate the ways that ours are designed better, but that doesn't mean that DHCS aren't good also. But we know that having the government in frontier is important to some communities. So DHCS has toolkits. We have toolkits. We're willing to co-brand. We'll co-brand them for you. We'll make you copies, like whatever you need to do to make it easy. We want to help enable people that want to help. So you can send me an email, darrel.ng@healthnet.com, or go to the Bridging the Divide CA site, and we will make sure we get a copy of the toolkit to you.
Sounds great. And just to confirm, I'm guessing, but not certain, each health plan in all the counties throughout California, not just HealthNet, they also have forms in different languages based on like the threshold languages for the county. Is it fair to say the toolkits are also designed in different languages?
I know ours are being designed in all 17 threshold languages. I'm sure in different counties have different threshold languages, but you can expect that for the 10 most popular languages, somebody will have a toolkit for you.
Awesome, Darrel. Well, hey, super helpful. I know you often get the word out about what's happening with HealthNet. That's your role. That's your team's role. If folks want to keep tabs on HealthNet or even kind of see what you have to share, are you active on social media? Should people just go to the HealthNet website? What's the best way to keep up to tabs with what you guys are doing?
Sure. So you can follow me on Twitter. You'll hear about the Lakers and about HealthNet. I'm at Darrel Ng. HealthNet is also on Twitter and LinkedIn and Facebook. For this audience, I'd say probably LinkedIn and Twitter are the two best social media platforms to follow us on.
All right, awesome. Well, I'll probably do that myself and follow you guys. I haven't already done that yet, so I appreciate that, Darrel. And again, appreciate you joining and taking the time to be on today's episode. I know I'll see you soon at a conference. So, anything else you want to share, Darrel, before we wrap up?
I do underscore that, in my view, it's a moral imperative that we all work together on this. If we are in healthcare to improve the health of the communities around us, to help those who are most vulnerable, this is the easy way that we can all do this, especially if you interact with Medi-Cal members regularly. So I encourage you to look into a toolkit, use the HealthNet ones, use the DHCS ones. They're available, they're free, they're customizable, and please use all of your communication channels to help your members.
Awesome, Darrel. Well, hey, man, really, again, appreciate you having, taking the time to be on the show today and us having you. And again, folks, check out what Darrel had shared. We appreciate you guys joining the show. And thanks again, Darrel.
Well, thank you very much. I appreciate it.
You're welcome.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode. And if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.